A few assessments for this week. We're going to start with the abdominal assessment. As you can picture here, we're going to start with understanding the places in your abdomen. And I have terms at the end to go over this too, but your epigastric area here, your costal margins are the edges of your ribs coming around here. So right in there where the costal margins come together, that's your epigastric area. Periumbilical is around peri, circumference, peri, around the umbilicals. And your pelvic region, and then your suprapubic is just above that pubic bone. Of course, your abdomen is divided into 4 quadrants, the 2 upper, the 2 lower, the right side, and the left side. In your, in your right upper quadrant in here, you'll have your liver and gallbladder. The main things on the posterior side is your kidneys on both sides. Your left upper, your stomach, it kind of sits in here, and then you have your spleen up under the ribs here. Right lower quadrant, you have your cecum, your appendix, your right ovarian tube if it's a female, the right ureter on the left ureter, left ovary, uterus sits in here, and your bowels, you have your large intestine comes around, so you have your ascending, transverse, descending coming down the left side into the rectum, and your small intestines in here, right, the ileocecal valve is somewhere right in here around where your appendix is, where your small intestines goes into your large intestines. Okay, so when you do your assessment, every assessment we've done so far has been inspection, palpation, percussion, auscultation. The abdomen is the only exception to that rule where the order is inspection, auscultation, percussion, and then palpation. You don't auscultate, don't palpate or percuss before you auscultate because you can disrupt the bowel sounds. So your first thing, as you do with every assessment, you start with inspection. You're looking at the contour or the shape of the belly. You're looking for symmetry, comparing right and left, up and down. You're looking for the skin for color, lesions, obvious masses, scars, moles, bruising. You're looking at the umbilicus, the belly button. You're looking for, is it in, is it out, is it disturbed, is it herniated? Pulsations, your aorta comes right down the middle of your abdomen. You also have your iliacs, so you're looking for any pulsations there. You're looking for hair on the abdomen, excess, absence, patches, things like that. What else? When you're inspecting the belly, the abdomen, make sure your light is good. You want to expose the whole abdomen so you can see it, but cover up the genitalia, and for a female, cover her breasts. You want them to be comfortable so they relax the abdomen. If you're inspecting and trying to do an assessment and they cannot relax, if you have them bend their knees, that will help. Also, if possible, to empty the bladder before you start palpating. Try to warm your stethoscope. If they have areas of pain, you always palpate, percuss the sore, painful areas last. Okay, let's see. Okay, so auscultation with your bowel sounds. Start in your right lower, go to your right upper, to your left, and your left lower. I always think of it as following my colon around, and there's your umbilicus right there in the center. You want to listen for at least 5 minutes. You don't have to listen for 5 minutes if you hear the bowel sounds right away, but you do not say bowel sounds are absent until you have listened for 5 minutes. Bowel sounds should be a medium pitch. They should not be real dull, and they should definitely not be high pitched or a tympanic sound. Bowel sounds should occur every 5 to 15 seconds. If they're occurring more frequently than every 5 seconds, they are considered hyperactive. If they are occurring less in a longer period, like every 20 seconds, more than 15 seconds apart, they are hypoactive bowel sounds. Auscultating for bruits, you have your aorta coming in here, your iliac arteries, femoral arteries down here. I'm going to have you use your bell on the aorta. That's the only one we're going to actually auscultate. You're listening for a bruit, which is the bell is the small side, or if you have a Lippmann, you just use less pressure for vascular. A bruit is a turbulence in the blood flow in an artery. Percussion, we did that on the back, and this we are going to do on the abdomen. So where in here you should have some hollowness in air, so it should be tympanic, that dingy sound. Over organs like your liver and your spleen, it should be a dull sound. And again, if there's areas of tenderness, you want to palpate those areas of tenderness last. You're also going to percuss your kidneys. You can see this image. You put one hand on and you tap or punch gently over that hand. You're looking for CVA or costovertebral angle tenderness. And you will do that on both sides, and always tell them what you're getting ready to do. Then after percussion is palpation. I only want you to do light palpation. RNs do not do deep palpation, so you'll only do the light. Again, if there's an area of pain, you want to do that one last. Otherwise, work your way around all 4 quadrants. Have a system. So you see here it says 9 quadrants. So 1, 2, 3, 4, 5, 6, 7, 8, 9. Kind of working your way through all of them, whichever way you want to do it. 3 across, just as long as you go everywhere. You're just going to do a slight palpation, and we will be practicing that in the lab. You're watching for facial grimacing. You're feeling for anything under your hand, any masses, firmness. Use 4 fingers to do this, only go deep about 1 centimeter. A gentle rotation, which I'll show you in the lab. Then lift your fingers off. Do not drag them across the abdomen. And note for any tenderness, pain, or firmness. So gathering your information, you're subjective, asking about their appetite. Has it increased, decreased, changes? What are there certain foods that they cannot tolerate? Is this a change? Are they having trouble swallowing? Are they choking on it? Is it on liquids, solids, on both? Indigestion, heartburn? Is it that occurring after meals, after certain kind of foods? Are they having any kind of abdominal pain? When did it start? You know, all those questions, when, where, why, how kind of questions. Nausea and vomiting. And if they're vomiting, how much are they vomiting? What color is it? Bowels. Frequency of their bowel movements. Is that their normal pattern for them? Are they liquid, loose? how many a day if they're saying they go in frequently. A lot of people will call it diarrhea when it's not really, because it's actually maybe 3-4 times a day, not 6. Ask about any weight changes, any history of GI disorders, such as any ulcers, gastritis, have they had surgeries, have they ever had any kind of hernias, umbilical hernia, inguinal hernia, any type of hernia, any organs removed, have they had abdominal injuries, something recently, and any medications they are on, especially if it's for the GI system. Terms, lots of terms for this one. An aneurysm is a defect or sac formed from dilation of the artery wall. Anorexia is a loss of appetite for food. Ascites is an abnormal accumulation of serous fluid within the peritoneal cavity, often that's accompanying liver disease. Borborygmi, I always have trouble with that, loud gurgling bowel sounds. That usually is when they have a bowel obstruction. Sometimes it's really if they have significant diarrhea, but with a bowel obstruction, you might hear this very turbulent, loud bowel sounds. A bruit is a blowing, swishing sound because the artery is partially obstructed. You may hear that over any artery. You don't want to hear it, but you might hear it. Cecum is that first part of the large intestines. Cholecystitis is inflammation in the gallbladder. Remember, this itis on the end is always inflammation, and your gallbladder, when they remove it, it's cholecystectomy. So cholecystitis is inflammation of your gallbladder. Costal margins, I mentioned as I was going over the slides, is that border of your rib margin where your diaphragm is. Gastrovertebral angle is those two areas on either side overlying the kidneys. Diastasis recti is when the middle of the abdomen has a ridge because the rectus abdominis muscle there has separated. Epigastrum, I mentioned on a previous slide, is abdominal region between costal margins. Hepatomegaly, megaly is always enlarged. Hepato is your liver, so hepatomegaly is abnormally enlargement of the liver. Splenomegaly is abnormal enlargement of the spleen. Hernia is an abnormal protrusion of the bowel through the weakened abdominal structure. That could be anywhere in the abdomen, umbilicus, down inguinal area. Paralytic ileus is complete absence of peristaltic movement. The gut is not moving. The bowel is not moving. Peristalsis has stopped. Peritonitis is inflammation of the peritoneum, the sac that covers in your abdomen. Scaphoid, abnormal sunken abdominal wall, usually malnutrition where the belly just sucks in. Extreme underweight. Already said splenomegaly. You have striae or linea albicans. Silver, white, or pink scar tissue from skin stretching is what we normally often will refer to as stretch marks. Suprapubic, I mentioned prior, is the abdominal region just above the pubic bone. Timpani, I have used that term throughout this lecture. It's that high-pitched musical drum-like percussion when you percuss on the abdomen. Umbilicus is a depression of abdomen marking entry of the umbilical cord. It's your belly button. Viscera is your internal organs. And that is the end of this lecture.